Warning signs of stroke in women. A stroke cannot defeat us and our willpower. Rise and take over the world. Yes, friends, we can't let down because of stroke. Let's know all warning signs of stroke in women, and lastly, we'll also reveal some important facts. So be with us till the end. Some of the stroke symptoms unique to women that may include nausea, vomiting, seizures, hiccups, trouble breathing, and sudden drowsiness. So act fast and get immediate medical attention if someone experiences a stroke. In our today's video, we'll show you how to fight with this stroke. Even we'll also tell you the advice given by the world's best doctor. So kindly do not skip our video for a second, and do not forget to like, share, and subscribe our channel for further this type of knowledgeable and interesting videos. When life's problems seem overwhelming, look around and see what other people are coping with. You may consider yourself fortunate. This famous saying keeps motivating us, but firstly, let's know the consequences. Is this stroke common in women? Do you know what's the reason behind it? If no, let us tell you that about 800,000 women have a stroke each year. A stroke occurs when a blood clot or a ruptured vessel cuts off blood flow to your brain. Every year, approximately 140,000 people die from stroke-related complications. This includes developing blood clots or catching pneumonia. Although men are more likely to have a stroke, women have a higher lifetime risk. Women are also more likely to die from a stroke. The Centers for Disease Control and Prevention estimates that 1 in 5 women will have a stroke and nearly 60% will die from the attack. Stroke is the third leading cause of death for women in the world. Do you know there are many reasons why women are more likely to have a stroke? Let's see. Women live longer than men, and age is another important risk factor for stroke. They're more likely to have high blood pressure. Pregnancy and birth control also increase a woman's risk of stroke. The more you know about the symptoms of stroke in women, the better you'll be able to get help. Quick treatment can mean the difference between disability and recovery. Do you even know that the stroke is the number 5 cause of death in the world and a leading cause of severe, long-term disability? That's why it's important to act immediately. Getting quick stroke treatment can save lives. If you want to know if you are having a stroke, then the signs of stroke in women can be subtle enough to be missed or brushed off. That can lead to delays in getting time-sensitive, life-saving treatments. Let's just see. Here are some of the common stroke symptoms: numbness or weakness in face, arm, or leg, trouble in speaking or understanding speech, vision problems, trouble in walking or a lack of coordination or balance, severe headache without a known cause. Additional stroke symptoms that might be seen in women are disorientation and confusion or memory problems, fatigue, nausea, or vomiting. Do you ever know why are women at higher risk of stroke than men? This happens because higher stroke risk in women might be due to pregnancy. The reason behind it was just a risk of stroke in pregnant women is about 30 per 100,000, with the highest stroke risk during the 3rd trimester and postpartum. Those with high blood pressure should be treated with medications and monitored closely. Second reason is preeclampsia, because there is high blood pressure that develops during pregnancy. Preeclampsia may triple the risk of stroke later in life. If you have any history of high blood pressure, talk to your healthcare professional about taking low-dose aspirin starting in the 2nd trimester. Third reason is birth control pills. The birth control pills have become much safer over time, but women who are already at risk of stroke should take extra precautions. Get screened for high blood pressure before the pill is prescribed, and never smoke while taking oral contraceptives. Fourth reason is hormone therapy. Yes. When it used in the initial years after menopause, hormone therapy that may provide some cardiovascular benefits. However, using hormone therapy later in menopause does not appear to have a protective effect against coronary heart disease and stroke, and may raise a woman's cardiovascular risks. Speak with your healthcare professional about whether hormone therapy is right for you. The last, and not the least reason, is migraines with aura. The migraine with aura is associated with ischemic stroke in younger women, particularly if they smoke or use oral contraceptives. Smokers with migraines accompanied by aura should quit immediately. Other than this, women may report symptoms not often associated with strokes in men. These can include nausea or vomiting seizures, hiccups, trouble in breathing, pain, fainting or loss of consciousness, general weakness. Because these symptoms are unique to women, it may be difficult to immediately connect them to stroke. This can delay treatment, which may hinder recovery. If you're a woman and unsure whether your symptoms are that of a stroke, you should still call your local emergency services. Once paramedics arrive on the scene, they can assess your symptoms and begin treatment, if needed. Do you know what is the symptoms of an altered mental status? So let us tell you that the odd behaviors, such as sudden drowsiness, can also indicate a stroke. Clinicians call these symptoms altered mental status, trusted source. And these symptoms include unresponsiveness, disorientation, confusion, sudden behavioral change, agitation, and hallucination. The researchers in a 2009 study found that altered mental status was the most common non-traditional symptom. About 23% of women and 15% of men reported altered mental status related to stroke. Although both men and women can be affected, women are about 1.5 times more likely to report at least one non-traditional stroke symptom, whereas many symptoms of stroke are experienced by both men and women. Stroke is often characterized by an inability to speak or understand speech, a strained expression, and confusion. The most common symptoms of a stroke are sudden trouble seeing in one or both eyes, sudden numbness or weakness of your face and your limbs, most likely on one side of your body, sudden trouble speaking or understanding, which is related to confusion, sudden and severe headache with no known cause, sudden dizziness, trouble walking, or loss of balance or coordination. Here, research shows that women often fare better at correctly identifying the signs of a stroke. A 2003 study trusted source found that 90% of women, compared to 85% of men, knew that trouble speaking or sudden confusion are signs of stroke. The study also revealed that the majority of both women and men failed to name all symptoms correctly and identify when to call emergency services. Only 17% of all participants aced the survey. Do you know what to do in case of such stroke? Let us tell you, a National Stroke Association recommends an easy strategy for identifying stroke symptoms. If you think you or someone around you may be having a stroke, you should act fast. Trusted source. When it comes to a stroke, every minute counts. The longer you wait to call your local emergency services, the more likely it is that the stroke will result in brain damage or disability. Although your initial reaction may be to drive yourself to the hospital, you should stay where you are. Call your local emergency services as soon as you notice symptoms and wait for them to arrive. They can provide immediate medical attention that you would be unable to receive if you were to forego the ambulance. After arriving at the hospital, a doctor will assess your symptoms and medical history. They'll perform a physical exam and other diagnostic tests before making a diagnosis. There are treatment options for stroke, and here the options for treatment depend on the type of stroke. Like ischemic stroke means, if the stroke was ischemic, the most common type, it means that a blood clot cut off blood flow to your brain. Your doctor will administer a tissue plasminogen activator medication to bust the clot. This medication must be administered within 3 to 4.5 hours of the first symptoms appearance in order to be effective, according to recently updated guidelines from the American Heart Association, AHA, and American Stroke Association, ASA. If you're unable to take PA, your doctor will administer a blood thinner or other anticoagulant medication to stop platelets from forming clots. Other treatment options include surgery or other invasive procedures that break up clots or unblock arteries. According to the updated guidelines, a mechanical clot removal can be performed up to 24 hours after the first appearance of stroke symptoms. A mechanical clot removal is also known as a mechanical thrombectomy. Other one is hemorrhagic stroke. Here, hemorrhagic stroke occurs when an artery in your brain ruptures or leaks blood. Doctors treat this type of stroke differently than an ischemic stroke. This treatment approach is based on the underlying cause of the stroke. Your doctor may suggest surgery to block blood flow to the aneurysm. Even your doctor administers a medication that will lower your blood pressure and reduce bleeding. Your doctor may recommend arteriovenous malformation repair to prevent any additional bleeding. Now we'll tell you about the treatment for women and men as well. Here, research has revealed that women receive poorer emergency treatment compared to men. Researchers in a 2010 study trusted source found that women typically wait longer to be seen after arriving at the ER. Once admitted, women may receive less intensive care and therapeutic workups. It's theorized that this could be because of the non-traditional symptoms some women experience, which can delay a stroke diagnosis. Stroke recovery starts in the hospital. Once your condition improves, you'll be moved to a different location, such as a skilled nursing facility or stroke rehab facility. Some people also continue their care at home. At-home care can be supplemented with outpatient therapy or hospice care. Recovery might include a combination of physical therapy, speech therapy, and occupational therapy to help you regain cognitive skills. A care team may teach you how to brush your teeth, bathe, walk, or perform other physical activities. Studies show that women who survive strokes usually recover more slowly than men. Women are also more likely to experience stroke-related disability, impaired daily living activities, depression, fatigue, mental impairment, reduced quality of life. This may be due to trusted source, to low pre-stroke physical activity, or depressive symptoms. Do you know each year, twice as many women die from stroke as they do breast cancer? That's why it's important to remain vigilant about your health. To help prevent a future stroke, for that you can eat a balanced diet, maintain a healthy weight, get regular exercise, quit smoking, take up a hobby such as knitting or yoga to help better manage stress. Women should also take added precautions because of the unique risk factors they face. This means monitoring blood pressure during and after pregnancy, screening for atrial fibrillation if over 75 years old, screening for high blood pressure before starting birth control. Stroke recovery can vary from person to person. Physical therapy may be able to help you relearn any lost skills. Some people may be able to relearn how to walk or talk within a matter of months. Others may need more time to recover. During this time, it's important to stay on track with rehabilitation and maintain or develop a healthy lifestyle. In addition to aiding your recovery, this may help prevent future strokes. Stroke is a leading cause of death and disability in the world, and women make up nearly 60% of all stroke deaths. Do you know why it is so? Let us tell you that in part expert says that women may have symptoms subtle enough to be missed or brushed off in the daily juggle of work-life balance. That can lead to delays in getting time-sensitive, life-saving treatments. Men and women who have strokes often experience a similar set of symptoms that can be remembered using the mnemonic FACED, face drooping, arm weakness, speech difficulty, time to call emergency from hospital. Either signs include problems seeing out of one or both eyes and balance or coordination problems. But some women experience other, more understated symptoms they may hesitate to bring to a doctor's attention or to online help desk operator. Women more frequently have a typical vague symptoms. They might start with fatigue, confusion, or maybe general weakness, as opposed to weakness on one side of the body. Many women may disregard something like a sudden, unusually bad headache if they're generally used to getting headaches. Or they may dismiss difficulty walking, exhaustion, brain fog, or an overall malaise, and instead blame it on stress or being overworked. Nausea or vomiting often gets explained away to viral illnesses. It's critical to zero in on any sudden symptom or loss in function that you can't explain. The key is that it's sudden, said Khatri, director of the University of Cincinnati stroke team. Studies suggest women are just as knowledgeable as men, if not more, about recognizing the more typical stroke symptoms. Yet because women are more likely than men to minimize their symptoms, they're also more likely to reach out to their primary doctor or drive themselves to the hospital instead of calling online emergency number, said Dr. Amadis Tofighi, Director of Neurological Services for Los Angeles County Department of Health Services. The key to getting the treatments we have available is having the ambulances alert the hospitals that they're coming with a stroke patient, so that the whole team is activated and ready to give the medication, said Tofighi, an associate professor of neurology and preventive medicine at the University of Southern California's Keck School of Medicine. Whereas if you just walk into the ER, you might be stuck in triage, waiting to be seen. And since women in particular may have non-traditional symptoms, the staff may not figure out right away that they're having a stroke, and there could be delays in getting seen and getting treatment. Main thing is that minutes matter during a stroke, which happens when the brain is deprived of oxygen after blood flow is cut off by a clot or a ruptured vessel. Treatment is extremely time-sensitive, and delays can increase the risk of death or permanent brain damage. When deciding whether to seek help, Khatri said women and men should be comfortable with the idea of a potential false alarm. It's not worth the risk of it being a true strokey that you fail to get treated for quickly, she said. Time is brain, and the longer you take to get definitive treatment, the more brain or tissue that's going to die, and the less well you're going to be in the long run. In fact, fast treatment can even completely reverse the stroke. It's worth taking that risk of being wrong, so let's hope for best, and now it's time to take leave, so do take very good care of yourself and your loved ones. We'll bring again the knowledgeable and interesting video. Till that, please be safe and protected. Thank you.